What is the risk of ILC recurring in breast cancer? Invasive lobular carcinoma of the breast has a unique pattern of recurrence that can happen both early and late after initial treatment. Understanding this pattern helps patients and doctors plan better follow-up care. Early recurrence usually occurs within the first 5 years and is often linked to more aggressive tumor features. Larger tumors, involvement of more than 3 lymph nodes, higher tumor grade, low or negative progesterone receptor levels, and a high proliferation index are associated with increased early recurrence risk. If patients do not receive adjuvant therapies like hormone-blocking treatments or radiotherapy after breast-conserving surgery, their risk of early recurrence can be higher. These early recurrences tend to happen when the tumor is more aggressive or when treatments are incomplete. Late recurrence, which happens after 5 years, is also common in invasive lobular carcinoma, especially compared to other breast cancer types. This is particularly true for hormone receptor-positive cancers, which make up most ILC cases. Younger women and those with higher body mass index are more prone to late recurrence. Because hormone receptor-positive tumors can stay dormant 4 years, the risk of recurrence persists well beyond the initial 5-year period. These late recurrences are often more influenced by patient factors than the initial tumor's aggressiveness. Recurrences can occur in the same breast, nearby lymph nodes, or in distant parts of the body. Distant recurrences sometimes involve unusual sites like the colon, uterus, ovaries, or stomach. The overall recurrence rates vary depending on the stage of cancer and the treatments used. Some studies report recurrence rates around 3 to 5%, while others show up to 21% at 5 years in certain cases. Generally, hormone receptor-positive ILC has a lower risk of early recurrence but a higher chance of recurrence over longer periods. Genetic testing, such as the 70-gene MammaPrint test, can help identify patients at higher risk of recurrence. This information can guide decisions about additional treatments like chemotherapy or targeted therapies. Long-term follow-up is crucial because ILC can recur many years after initial treatment. Regular clinical exams, imaging, and adherence to hormonal therapy are essential to catch recurrences early. Because ILC can be harder to detect with standard mammograms, more careful and ongoing monitoring is recommended. In summary, the risk of invasive lobular carcinoma recurring depends on many factors, including tumor size, lymph node involvement, hormone receptor status, patient age, body mass index, and whether treatments were completed as planned. Early recurrences are often linked to tumor aggressiveness and incomplete therapy, while late recurrences tend to be related to hormone receptor positivity and patient factors. Staying vigilant with long-term follow-up and personalized care strategies is key to managing and reducing the risk of recurrence. Always consult with healthcare professionals for tailored advice and treatment plans based on individual circumstances.